Hello, everyone. Welcome. Today is Trendy Tuesday. We're going to be talking about common birth control questions that you guys are asking Google. My name is Iris or Iris. I am a rising senior studying biological engineering at MIT and working with Pandia Health this summer. And with us is Dr. Sophia Yen, who is the CEO and co-founder of Pandia Health, who also went to MIT. And she's going to be helping us address these questions with her expert knowledge, as she is an adolescent medicine specialist, right?
Yes.
So before we get started, make sure that if you already have an active birth control prescription, go to pandiahealth.com. You can get your refills automatically and the birth control delivered for free straight to your mailbox. In these days, that's a blessing. So please don't go out to the pharmacy. Stay home, stay safe. If you need a new prescription, we are our expert doctors. You can get we can get an online or virtual consult with one of our doctors in the state of California, Florida, Texas, and Wyoming.
And Arizona.
Welcome,
Arizona.
Yes. Come join us, Arizona. You're new to the party.
Yes.
All of our doctors are expert doctors, and they know what's right for you. So make sure to sign up today. And if you do, use the code TRENDING, which is scrolling here at the bottom, and to learn that you heard it from us. So the topic for today are some period timing questions that people are asking Google. So I guess the first question is, what's a normal cycle like? 28 days? Is that if my period's a day late, am I in trouble? What if I'm bleeding for 10 days straight? Things like that.
Yes. So the normal cycle ranges from, let me check my slide, 21 to 34 days. So it can happen we count it from the first day of your bleeding to the next first day of your bleeding. So it could be only 21 days for the unfortunate ones, or it could be 34 days for those people who aren't blessed with bleeding far more frequently. And then in terms of how long does it last, some women only have 2 days of bleeding. Some women have 7 days of bleeding. So if you only have 1 day of bleeding, then it isn't a real bleed. It might be just spotting or something. But if you have more than 7 days, you should definitely talk to a doctor and figure out, that's a little bit too much and you're at risk for anemia. So the number one cause of anemia in a menstruating woman that we teach medical students is menstruation.
Yeah. I had anemia when I was younger. So that's probably why. But awesome. Thank you so much. So it ranges per person, but more than 7 days, it's a problem for health.
Yes. Oh, and then just a caveat, we get a ton of these questions on YouTube. If you just started your period and it's within 2 years of starting your period, so starting your period is called Menarche. It's a life event, and you want to write down the date because doctors will always ask you, when was your first period? Menarche. If you're within 2 years of menarche, your period can be totally whack and we don't really care about it. But if it's been 2 years since your first period and then it got all normal and then it got all whack, then you definitely need to talk to a doctor and see what's going on. And anytime you miss 3 periods in a row, three periods in a row, and you're not on any medication, then you need to talk to a doctor to figure out what's going on.
Okay. So the medication could be?
If you're not on any medication. If we put you on the birth control pill, patch, or ring, then you can decide how often you want to have a bleed. You can have it every month, every 2 months, every 3 months. Every 6 months. Never. I choose never.
Yeah. So that's leading into our next question is, how do forms of birth control affect how do they affect your period?
So if you're on the pill, the patch, the ring, you can make your period happen every 4 weeks. And that's pretty much how it's structured. It has 3 weeks of hormones, and some of them don't even give you the last week. And then some of them do have some sugar placeholders, or some of them have iron with sugar placeholders because you're causing yourself to bleed. And so they want to give you back some iron. But that week off is totally optional. So you can choose to skip that and go straight into the next one on the pill and the ring. And then on the patch, you can also do it, but only for 12 weeks maximum. If you're using the copper IUD, that often causes heavier periods. I don't know if it causes more days, but it can and very well will cause heavier periods and possibly with more cramping. The IUD with hormone, 30% of those women lose their periods and they're like, yay. and then 70% get lighter. And so that is also wonderful. The implant is similar as well, and the shot also.
Okay, cool. And you mentioned earlier about the patch, how you should come off of it for after 12 weeks, you said?
Yes, if you're using the patch to skip your periods and you've done it for 12 weeks in a row, you have to have a bleed on the 13th week because the hormones have built up in the estrogen from the patch, the research has shown, and puts you at risk of blood clots and death. So we don't want any blood clots, we don't want any death. So after 12 weeks in a row of the patch, have a bleed. With the pill and the ring, you can go as long as you can go.
Okay, awesome. So with the ring, this is the next question. How long does it take after you remove it to get your period?
Great question. So with the pill, the patch, or the ring, they all work the same way. They give you hormones for 3 weeks, or in the case of the ring, it actually has 35 days of medication. And then when you come off, that's when your body decides to bleed. So if you're off of the pill, off of the patch, off of the ring for 2 or 3 days, by the second or third day, your body will bleed.
Okay, awesome. So it's like a cleaned it out. 24 or 48 hours afterwards, you should get your period. Your body has taken the signal.
It has, it's like, where did the hormones go? Okay, I guess I'm just going to clean out the uterus now, because whenever you take away progesterone, your body will be like, oh, let's rinse this sucker out.
Yeah. When you look at the little graph for the fluctuating hormones in the period, there's a big drop in progesterone right before, and I assume that's what causes it. So
yes, that is what causes it.
So with a lot of people, we're stressed because of the pandemic, life, me, medical school eventually. So how does stress, how long can a period be pushed back by stress?
Yeah, so I think that just normal stress could probably push it back like a day to like 14 days. You'd have to have some serious stress, I think, to completely miss a period. I think I've done that maybe once or twice in my life. And the irony is you miss a period, it's late, and then you just get more and more and more and more stress. And so it just pushes it farther. And so if you don't get a period by 8 weeks, or, the second time that you should have gotten your period, then you should see a doctor and presume that you're pregnant, unless there's no risk of being pregnant. Certainly, if you are only having sexual relations with the same gender, or if you're only having sexual relations with yourself, or you're not having any sexual relations, then you shouldn't worry about pregnancy. But if you're having anything that risks you of pregnancy, then assume that you're pregnant, which means don't drink, don't smoke, don't do drugs if you intend to continue the pregnancy. But it definitely can, I think, cause you to miss one period. But if you miss 2 periods in a row, 3 months without a period, go see a doctor. You might have a tumor, you might have thyroid disease, you might have anorexia, you might just be crazy stressed. But 3 months or missing 2 periods or 3 months in a row of no periods is by definition pathological. If you're not on any birth control pill, patch, ring, or any hormonal contraception to stop your periods or whatever, that's not normal. Go see your doctor. But definitely stress can do that. And we talked about in our previous talk that stress the way it works is your body's like, she's in a fight or flight mode and she's running away or she's fighting off a tiger. This is not the time to get pregnant. And so that's why it's like, do not pop out an egg. This is not the time to get pregnant. So I think right when your egg's about to come out, it's like, is now a good time? Does she have enough nutrition? Oh my goodness, she's running away from a tiger, which is your stress, mode. And so now is not the time to get pregnant.
Yeah, our bodies are beautiful evolutionary machines, which have determined that when you're not eating and when you're really stressed, you should not be pregnant.
If you can't afford to feed yourself, how can you afford to grow a baby?
Yeah. So it's okay. Just make sure that you go see a doctor if it's been 8 weeks. But if you have an exam like 5 days from now and you haven't gotten your period today, maybe it'll come.
Yes.
So I guess kind of related to what I just said is, how can I get my period today? That's a question that was in Google. So can I manipulate that myself?
There is nothing, to my knowledge, that can get your period today. In medicine, if a woman hasn't had her period ever, or if she hasn't had her period for like 3 months and we want to test to see that everything's functioning, that her uterus can grow a lining, that it can shed a lining or whatever, we'll first do a progesterone test where we give progesterone for 5 days. And the fact that you dump the progesterone, the hormone level goes down, then by day 2 or 3, then you get a bleed. Same kind of thing with the birth control pill. If you're on the birth control pill, patch or ring, and then you want to have a period today, that person we could do in 2 days. So you stop the medicine today, and then in 2 or 3 days, depending on your body, how long it takes you to get rid of the hormones, you will get a bleed. And that's a withdrawal bleed. It's not a, quote, real menstruation. And then in the progesterone person, I forgot to mention that if you don't have enough estrogen in your body, so if you're anorexic and you didn't make enough estrogen, and we put progesterone on, there's nothing to bleed. So a follow-up on the progesterone, if you don't bleed, is we would give you estrogen and progesterone and then pull that away. And if we pull that away and you don't bleed, then something's messed up. And we need to check on it. But there's nothing in my knowledge that will make you bleed today. Please, if any OB-GYNs are on this, please feel to chime in otherwise, but there just isn't ever a need to like bleed today, to my knowledge. Usually it's a stop bleeding. And you can also do that with birth control pills, but don't do that unless you do it with the doctor. Otherwise you risk blood clots and other stuff. I think what maybe the person who's asking is they want to bleed because, one, they haven't bled for 3 to 6 months and they may have polycystic ovarian syndrome. So Google Pandia Health Polycystic Ovarian Syndrome. We have a great blog on it. And there's a great video that I did for Stanford on the treatment of polycystic ovarian syndrome. And the treatment involves the birth control pill, patch or ring, or another drug called metformin, or even better, the two together, and exercise and diet modification. Or the person asking this question might think they're pregnant and they just want to bleed now, and they're kind of in denial that they're pregnant, just they don't want their period, you know what I mean?
Yeah.
And if you are pregnant, you have a positive pregnancy test, or there's any chance you could be pregnant and your breasts are hurting and you're barfing, those are signs of pregnancy, then you need an abortion. And that is not something we cannot just induce a bleed when you're pregnant. That requires a medication abortion or a surgical abortion. And there are some companies out there that will do the medication by mail or online. So check it out. One of our friends, Plan C.
Ah, that's such a clever name. Awesome. Yeah, so I guess you can't really manipulate it on your own. It's medical. You mentioned that the first case, is it that if you've never had your period ever, like if you haven't even had like menarche before?
If you haven't even had menarche, if we think that it's polycystic ovarian syndrome, then we'll throw on some progesterone and then pull it out. If we think it's anorexia, then we can check a blood level for your estradiol level. And if it's not 40, then you don't have enough estrogen to bleed. And so there's a whole workup if you haven't had your period by 13? I think it was if you don't have your first sign of puberty by 13 and probably your period by 15, then we need to work it up.
Okay. I didn't know that anorexia decreased your estrogen levels.
Oh, yes, absolutely. And so there's a whole controversy on, do we put them on birth control pills to make sure their bone density is good, but it hasn't been shown to help. And I think the reason it doesn't help is because they don't have enough calcium or vitamin D to support whatever the estrogen would be doing.
Yeah.
So you just got the problem with the anorexic patient is they're missing lots of nutrients. And so my same thing with, they've shown that antidepressants don't work so well on them. And my thing is because they don't have the precursor to serotonin. So my theory is you should whole bunch of turkey and an antidepressant, because then you've given the building blocks for the serotonin, or maybe a whole bunch of serotonin. And then the antidepressant, which keeps the serotonin around longer. Or if someday we develop just a serotonin shot.
Yeah, that would be nice.
Or pill. Or pill.
I think a lot of people are waiting on that one.
Yes.
Well, awesome. Those are all the questions that we had for today. Thank you guys for tuning in. If you have any more questions, be sure to leave them in the comments. I will look at them and maybe bring them up in the next Q&A that we do next week. So make sure to tune in next week, same time, 8 p.m. Eastern, 5 p.m. or 8:30 p.m. Eastern, 5:30 p.m. Pacific. We'll be here every Tuesday with Dr. Sophia Yen, and make sure to check out Pandia Health services at pandiahealth.com. And if you sign up, use the code TRENDING to know that you got it from us. Cool. Thank you, guys. Thank you, Dr. Yen, for tuning in. And
thank you, Iris, for doing this. And tell all your friends we're the only doctor-founded, women-led company in birth control delivery.
Yeah. They want what's best for you.
Yes.
Bye, everyone.